the training back home at India, uh, here we are patient focused, clinical oriented with volumes of work, having a lot of clinical work in our clinical departments.
It gets quite boring to just be doing the same procedure again and again. So, what's your perspective on that? As in, I'm sure you've been practicing for so long. So, how do you feel about the procedures? Like,
I don't think there is any calculation
okay.
on how do you maintain that state of mind, or I think it's just.
Hello, Dr. Dhaval.
Hi.
Thank you so much for joining us here today.
Pleasure.
So, before we start, we'll have a quick ice-breaking session,
Sure.
and I'm going to ask you a couple of dental questions, and whatever comes to your mind, you can answer that.
Surely.
So, which is your favorite dental instrument?
Dental scaler,
Okay, bye.
because I'm a periodontist.
Which is the dental procedure that you enjoy the most?
It has to be performing implant procedures, implant surgeries.
Who is your favorite dentist?
My wife would be.
Okay. Which is your favorite dental brand?
Dental brand, since we are a lot into implant dentistry, Nobel Biocare is my favorite brand, which is now a part of the investor group.
Right. What was your score in final year BDS?
Wow, that's a googly. I passed.
Okay, the subject that you dread studying as a BDS student?
First year BDS, biochemistry.
Okay. Which is the favorite book for periodontics?
As in my favorite book, Carranza or Glickman.
And the 3 things that you love about dentistry and the 3 things that you hate about dentistry.
Okay, so things which I like about dentistry is that we try and change people's smiles. Indirectly, we change personalities. Flexible working hours. Uh, there's not too much of stress related work and not emergencies. So yeah, 3 things which I don't like about dentistry. Uh, in an area of the body where there is a lot of fluid, which is saliva. I hate working in too much of saliva. That's one. I don't think I remember anything else. I don't know.
Great. Okay. So let's just get into the set of questions that I have for you today. I'm sure this conversation would help a lot of our family at MediStudy Go learn a lot of things. And as fresh graduates, we have a lot of questions. So I hope you're able to, get to understand a perspective of a fresh graduate. And in this conversation, we'd be able to help a lot of fresh students who just come out of dentistry.
Surely, this in fact takes me back 25 years, or sorry, 26 years ago as a graduate. So nice.
So dentistry keeps evolving every day. So how do you keep upgrading yourself all the time?
So one is, I think, passion for the subject, doing good work, and doing the best for the patient. I think that is what drives me and our team here at our office. Having said that, we like to go back to books uh, and see if how the concepts are changing, and try to brush up and read both the contemporary as well as the evolving science, and of course by attending various continuing education programs.
So as a fresh graduate, now that I look at it, I know that learning never ends. But do you think it would be nice to start your specialization right after BDS, or wait for a few years, practice, and then start, or just not do an MDS or a master's?
I think all 3 works, because as in my case, I graduated and then I worked for some time, and that's where during the work phase I realized that I was working, and one of my mentors, he actually uh, mentored me and pushed me to do my post graduation, and that's how I completed my post graduation. Having said that, then when we passed as dental graduates, and now there are a lot of options in terms of what you can do post after you finish your graduation. So I think now, in today's era, if you are just a graduate, there are a lot of other openings. So that's fine as well, if you want to pick a career uh, after that. And not doing a post graduation, yes, that's also an option. In fact, I know so many dentists who have excelled and are not postgraduates.
So, is there a specific thing that you saw about them that differentiated them from the other BDS graduates?
Yes, the only one factor is passion in what they do.
Right. So, you also spoke about mentor, right? I'm sure a mentor has played a very important role in your journey here. So, if you could, brief us about how you should select a mentor and how it really helps, in your journey.
Surely. So I think I today I am what I am because of a lot of mentors. I'm a product of a lot of guidance through which I received from many mentors. So I think a mentor plays a very crucial role in showing the direction and polishing your thoughts on which direction to head for. Having said that, an ideal mentor would be one who knows you, who tries and ensures that you have your future is dependent on the journey which you're following, and the path you choose, and the right path which is customized for you as an individual. I think this is the most important thing, and not just pushing you in the common path where everyone is going. So that, according to me, is very crucial. Also, a mentor is someone who would ideally tell you the who will be extremely be critical on what you should not be doing.
Correct.
And that's where most of us are not self-aware. For example, I was not aware that I was very happy after my graduation, and I'm the king of the world. But thanks to my mentor, who actually who showed me a direction and said that no, you need to study further, and you're good at this. Sometimes we don't know what we are good at. So that is something which also a mentor picks up and brings to your notice.
So, you have mentors in various countries since you have now practiced and have a lot of fellowships there. So, what is the difference in the kind of mentorship and the kind of training that you get in India and what you got abroad?
I'd like to answer it in two parts. One is the training back home at India. Uh, Here we are patient focused, clinical oriented, with volumes of work, having a lot of clinical work in our clinical departments. Uh, so this is one thing which is very good back home at India. And abroad, the focus of the dental education is a 360-degree approach.
Okay.
It's not only to do with your clinical skills, but also to do with your non-clinical skills. Okay, and also in terms of asking a lot of whys. So that brings out the research uh, uh, personality in you, and you may at some point in time think of going in that direction, along with a few administrative and other skills on patient records. So that is something which I think I learned a lot from my training abroad. The patient records is something when you come back um, in your clinical practice is which will help you tremendously.
Right. So, you spoke about non-clinical skills. I understand it's related to patient education. But apart from that, what are the core skills that one can focus on building in India if they don't get a chance to go abroad?
So I think there has been a sea change when we we graduated, and your generation who graduate now, and the change is that apart from clinical dentistry, there are a lot of other avenues which are open. So, for example, one of the example is right sitting next to me, and I think this is, I think, one of the most upcoming fields in terms of online reach to not only graduates but also clinicians. And I think the online forums have grown by leaps and bounds.
Right.
Having said that, there is lacunae in terms of quality online forums,
Right.
and something like a medi study where there is a genuine purpose to uh, help the graduates and the clinicians, and I think it's a fantastic thing. So having said that, there are a lot of other avenues, and those could be in terms of I think medical writing is something which I see now in a lot of young graduates who take it up almost as a full-fledged career.
Right.
There are a few graduates whom I see that they pursue their MBA, for example, and they follow it up by joining some not only dental but probably medical corporates.
Right.
And I think that is one career option which I see which is becoming trendy in the last couple of years.
Right. So it's definitely something that we as young people want to change, in the sense that it gets quite boring to just be doing the same procedure again and again. So, what's your perspective on that? As in, I'm sure you've been practicing for so long. So, how do you feel about the procedures? Like, are you bored doing it, or do you come every day with the same energy? How do you maintain that?
Yeah, so in fact, this is a very good question, because I think once you finish your training, whether you're a graduate, whether you're a postgraduate, and if you are into whether you're into clinical work or a non-clinical work, I think end of the day, we all start our journey, and somewhere it becomes monotonous.
Right.
In terms of walking into the office at 10 o'clock and probably doing the same procedures, and how do you maintain the same mm, energy
Correct.
to do that. So I don't know how I still get excited with the procedures I do. Uh, I restrict myself to doing perio and implant dentistry only. But even now, after so many years, if I have to do a simple procedure like oral prophylaxis, I mean, it still excites me. But that's my personality. I think everybody will have a different type of personality. I don't think there is any calculation
Okay.
on how do you maintain that state of mind, or I think it's just purely passion in what you're doing, and whether you are trying to bring in a difference to the individual. Now, that's, I'm talking in terms of clinical practice. If we are talking about a non-clinical practice, uh, there has to be an element of passion in what you're doing, whether you're trying to bring in any difference in the organization where you're working, or whether you are a startup founder like you, whether you're trying to bring in quality change. I think that is something which will try and not make it monotonous.
Right. So you spoke a lot about passion.
Yeah.
Did that come to you as a BDS student or an MDS student? Like, when do you think it started coming? Like, okay, now I feel like this is what I want to do all my life.
So I think this is such a good question and a very valid question, because I think the first 2 years of my undergraduate program, and I'm sure you would all relate to me, I was lost, and I don't think I was really, I was not focused at all on what to do and what not to do. It is only when we started our third year clinics is when okay, we started getting exposed, and all of us, we get exposed to a lot of different clinic postings.
Right.
And eventually, I think in about once I graduated to final year is when I started realizing that okay, there are a few clinical postings which I like, and a few clinical postings which are okay. in terms of what I would not like to do.
Mm.
So I was very clear on that around final year.
Okay. So that's when you thought that, okay, I like perio. And did it start right there, or you had to like wait till a couple of times till you saw people doing it, or it was just something that came to you?
No, so again, this is a very good question because I think once we finished our final year and we went into internship is when we started seeing a lot of our most of our I think most of our majority of our time was spent in the clinics. So I used to actually see go out of my way to few of the clinical postings, even if my postings were not there in the departments, especially in perio or oral surgery, and started requesting our academic staff that if can I come and observe a few things which are happening, because I think as an undergraduate we are not really aware on the spectrum of work which happens in any particular department or a unit. So that's where I started engaging myself more with these two departments, and that's how I started my journey started in terms of I was getting clear on where I want to head to.
Right. So, in terms of the spectrum of periodontics, if you just had to explain in a few things what all you can do, how would you explain it to somebody who is thinking of doing perio?
Okay, so again, there has been a change in the thinking patterns on a perio graduate. So if you are planning to pursue your perio post graduation, there are different avenues where you can think of. I would divide it into two parts. One would be clinical and one would be non-clinical.
Okay.
In clinical, of course, the routine clinical perio practice. Okay, and again, even at during my time, there was always a negative thought on somebody pursuing a subject like periodontology. I never thought about it at any stage of my career. And I think as a clinical perio graduate, there are a lot of things which you can do in your clinical practice. And it just doesn't involve your oral prophylaxis, which is scaling and root planing, because a lot of other things in the soft tissue where you can think of, and you can be a part of a multidisciplinary clinical practice where you can bring difference in terms of the soft tissue diagnosis of a lot of disorders which generally in general practice are not focused on.
Okay.
When it comes to non-clinical, perio graduation program is quite robust in India. So there is, for example, we have a mandatory submission of a library dissertation, a main dissertation, which is what is called as a thesis program. So there is a lot of academic work which you have to do as a perio graduate. So then you can also think of branching into the medical writing work, which I see nowadays. A lot of young perio graduates are following that path. Some of the perio graduates are also getting on board as advisors to some of the pharma companies and corporates. So yeah, so these are the different avenues where you can think about.
Right.
On how do you maintain